started. It's just a cat with a mammary mass. This one here looks like there's something going on here as well. So the owners were offered to do a biopsy or go straight ahead with bilateral mastectomy if feasible. Because of the don't know what's happening there either. Because of the size of the mass, it was more likely to be someone's, yeah. It was more likely to be malignant, so the owner decided to go straight ahead with bilateral mastectomy, knowing that 80. Is that yours? It's finished. That 85 to 90% of these mammary masses in cats are malignant. So the way I do these is have these cats in, I like to do these single session. So I have these cats come in, anesthetize them, clip them up, mark the margins, and then see how well those margins meet in the midline. If it's easy, then proceed with single session bilateral mastectomy. If I'm concerned about the degree of tension, particularly over the chest cage, then I will just convert that to a unilateral. So as you can see here, that meets very easily. This is probably the more difficult part, but again, it meets easily. So we can do a single session bilateral mastectomy, which is usually the case. And so the advantage of doing that is that it's one surgery, one anesthesia, one recovery. The actual surgical approach is not that different from stem to stern. You're still doing the same, whether your incision is down the midline for a unilateral or lateral to the contralateral nipples if you're doing a bilateral. So the actual surgical approach is not that different. And then, excuse me, the risk of complications is not significantly different. It's around 22% with unilateral and 38% with bilateral. But with the unilateral, it's 22% times 2. So you've still got a similar risk of complications overall. So I just like to go through the subcutaneous tissue with the cautery, or the deeper dermal tissue, I should say, just so I can get the jaw blades of the ligature through. The one thing with this surgery is it tends to be one of the more painful things that we do in cats. So sometimes these cats will stay in for 2 days after surgery, just on fentanyl and ketamine CRIs. So for that reason, unless you have a overnight care facilities, this is not the kind of surgery I recommend just a day practice to do. you see many of these in India?
Yes. I've attempted like 3 or 4 times this bilateral ones, and I do unilateral.
Yeah, I don't remember seeing it at all in Australia. Went through my 2-year fellowship at CSU, not seeing one, and ever since being in Ontario, they're so common. So I do take the inguinal fat pad on block with the mastectomy, and just leave it up to the pathologist to find the superficial inguinal lymph nodes bilaterally. And somewhere in here is the caudal superficial epigastric artery and vein. In cats, it's fine to go through that with the ligature, but in larger dogs, you want to individually ligate those vessels rather than. Thanks. You also want to try and do these surgeries as quick as possible without kind of rushing things, because they're cats, they're going to be cold usually with the anaesthesia, and then you've got a large surface area exposed once you do the mastectomy. So you do want to get things resected and then close pretty quickly, just to minimize that heat loss. So that's where something like the ligature really comes in handy. How many of these would you have seen by now?
Quite a few.
Just saying that until coming to Ontario, I'd never seen one. And since being in Ontario, we see them so frequently.
Do they do these in India? Bilateral, or do they do them staged?
I do it more of a unilateral,
Okay.
but I have done like 2 of them bilateral. But those were like big masses and got micros.
But I also don't know if I've ever seen bilateral before coming here.
Okay. That's not unusual, as most people do stage unilaterals. I think that paper in JAVMA a few years ago kind of scared them off, but it's a paper kind of presented it the wrong way. You know, they said there was significantly more complications with a bilateral, but they compared it just to a unilateral rather than, so there's like 38% for a bilateral and 22% for a unilateral, but it's 22 plus 22. And the other thing I argued with that one is that even if it is more, then the cost of managing the complication and the pain experienced by the cat in managing a complication would be much more likely to be far less than doing a second unilateral. The difficulty cranially is that the mammary tissue kind of gets intertwined with the pectoral muscles, so which contributes to the pain of this procedure. Can we have some 3.0 monocryl and 3.0 nylon, please? The monosoft. So again, I'm coming as far laterally on the subcutaneous tissue as I can, just to get all that mammary tissue. And that's our mass there, so I'm going to come a little bit deeper and get a pectoral muscles on this for deep margins. So here's our pectoral muscle layer here for deep margins. Let's just see. Yeah, thanks. If you wanted, you can start on the subcute and we're almost finished here. Mateo's just going to get a start on the skin, so the subcute layer. You can come this side if it's going to be easy for you. And you can see how this is a relatively bloodless field, which is the nice part of the ligature. I'm just going to see if I can feel the axillary lymph node at all. We'll see it. I really should probably do more central lymph node mapping with these. I can't feel or see it. Okay, so let's take that away. So this cat's a little bit fatter than most, so we actually have a bit more of a subcute layer to work with. Some of them are very thin skin, and that makes it a lot more difficult. Just doing about that long. I think I just need to get underneath it.
Staplers and CAT scan?
You can use staplers. I tend to prefer just there's a fair bit of tension on it, and sometimes staplers, because they don't have a great bite, are not as good as an interrupted pattern in overcoming that tension. So yeah, I prefer to use personally cruciate sutures for me for any area where there's tension. But you're right, we've used staplers for bilateral, particularly in dogs before. Any large incision, it's also obviously nice to use staplers, which it's nice and quick. Can we have another couple of packets of the Monosoft, the 3O Monosoft? Just on the table's great, thank you.
What I like about the ligature is that it creates this nice
Seared tissue to.
so you try to like grab it. With a better hold.
Yeah. Yeah. Correct. Yeah. Squeeze one more suture out of this one. So Matteo is just finding the challenge with the closure of these. Often I find if we close from cranial to caudal, actually you can't really see what's happening here, but when you close from cranial to caudal, it closes in a straight line. But when you go from caudal to cranial, you kind of get this situation where it's almost going to close better as a T. So Matteo will work out what he wants to do up there. So this wound is largely closed now. The cat has 2 bear huggers going either side to try and maintain some degree of body heat. What is her temperature now?
We are 35.5. We got down as low as 34.7.
So I'm not sure whether you heard that, but she's right now at 35.5. She'd get down as low as 34.7. So you're getting this wound closed, plus the active warming that we're trying to do is getting her back up where we want her to be.
We started at 38.2.
Mm-hmm. So I'm, again, not sure whether you heard that, but we started at 38.2. So you've got to love anesthesia in cats. Well, still got to love anesthesia in cats.
Yeah.
So let's do one quick one there. You got it a straight line. Good job.
I'll be able to.
I'm sorry. Can we have another 2 of the 3O monosofts, please? Actually, just make it 1 for the time being. We may need a second. Thanks. We're asking a lot of it. So Matteo knows how much I hate corners on incision, so he's done a great job getting this closed as a straight line.
Straight-ish.
Little swerve in the road there, but that's okay. I was almost able to keep pace with him there.
Yeah, you're fast. Start with this.
For incisions like this, it's always nice to have two people closing.
Sorry, Dr. Christian, we're cutting that.
Leave the rest to you there. I can grab that if you want.
Okay.
So Matteo's just going to finish up here, then we'll get the cat warmed up and woken up. I'm just going to do the inking. All the sharps so far in the sharp container. I'm just going to go and ink this. Thank you, everyone.